Hello and welcome to my video on dental implants and tooth replacement. My name is Dr. Alex Devellerez and I'm one of the principal dentists here at Sparkle Dental. One of our roles and one of our duties here at Sparkle Dental is to be able to talk to our patients and inform them and give them all their options in terms of their dental treatments. And one of the big ones that we have to deal with is explaining to patients what their options are in terms of tooth replacement. Like advancements in saving teeth, we have a lot of advancements in technology now to offer patients in terms of what they can do in terms of replacing their teeth. We see a lot of patients who have long suffered with dentures or lost their confidence in smiling and difficulty in eating, and it is very rewarding for us to be able to talk to our patients and give them their options so that they know the full picture in terms of what they can do to improve their situation. So some of the things that patients are told and educated about is when their tooth comes out, they do have pretty much 4 options that are available. First off, and a treatment that's always available is that the tooth isn't replaced, the tooth is left as a gap. And the obvious benefits of doing that is that there's no cost, there's no further dental procedures, and typically the patient's out of pain. But the downsides of that longer term is that obviously now there is a gap in their smile, there is the patient's potential difficulty in chewing, and also the bone loss and the loss of gum tissue that comes with losing a tooth. There are some studies that show us that in the front of the mouth, when a tooth is removed, that 60% of that bone is lost in the first year. That can, for some patients, become significant if there is multiple teeth that are lost, where we see some effects on the face, where there's some shrinkage of the face, and also potentially some effects of premature aging. So when we talk to our patients in terms of what is available other than doing nothing, there pretty much are 3 options. 1 is dental implants, 2 is what we call crown and bridge, and thirdly is what we call removable prostheses or dentures or plates. So let's deal with the first one first, which is dental implants. Now, dental implants are considered to be the standard of care in terms of tooth replacements. Basically, what a dental implant is, it's a titanium root that is placed into the missing tooth space. The titanium root then bonds to the bone, and then what we do is we put a natural looking tooth on top of that particular titanium root. Now, the benefits of the dental implant is that we don't have to touch any of the remaining or surrounding teeth. It is the highest predictability and longest lasting restoration we have in dentistry, and you know, it looks and in some cases feels like the patient's sort of tooth that they've lost. The potential downsides of dental implants is that it's not potentially for all patients. Sometimes medical conditions can be a contraindication. For some patients, the bone loss has just been so extensive that even with our modern augmentation techniques, we still can't replace that tooth. And obviously there are procedures involved in that, and there is the cost. The cost of dental implants is significant, and in some cases can range between $5,500 to $6,000 in some particular cases. And the duration of treatment can be between 4 to 6 months. So there's some of the consideration for patients to consider. The other 2 options, one is crown and bridge for replacement of the missing tooth. The way that this is achieved is that the 2 surrounding teeth either side are shaven down, a porcelain bridge is constructed and then cemented in those areas. The benefits of this treatment is that it is fixed, it is reasonably faster than the dental implant treatment, definitely. But there are, like all of the procedures, there are some potential downsides. The downsides of the bridge is that it doesn't stop the shrinkage of the gum and the bone where the missing tooth is. It does involving the 2 surrounding teeth, where in some cases some of those surrounding teeth have had nothing done to them, so it does potentially make the problem bigger in the future. And the final option is the removable option, which is dentures or plates. Now, the benefits of the plastic or metal plates is that they are the most economical way of replacing multiple missing teeth. They're fairly quick to make, they don't involve any surgical procedures, but the potential downside is that once again, we're not stopping the shrinkage of the gum and the bone tissue. Some patients do struggle in terms of keeping them in the mouth. They can be loose when they're talking and eating and smiling, that they lose confidence and they're wondering, when is this thing going to fall off or whatever else. So there are some shortcomings of that treatment as well. So I hope by me going through some of these options, this gives some patients some of their options in considering some of these options here. Dental implants, crown and bridge, dentures is something that our dentists here at Spark Dental are extensively trained in. We really do see our role in terms of educating all our patients so that they are clear on their goals. I in particular quite enjoy all phases of the dental implant treatment, in that I find it particularly rewarding to take a patient who has suffered with dentures and is now able to smile with confidence and enjoy their food, and taking that person to a level where they can smile and eat and do the things that they want. That to me is particularly satisfying. So please browse our website, have a look. If you have any questions, please feel free to call our friendly team on here at Sparkle Dental. And hopefully one day we look forward to seeing you one day, where we can talk and go through any questions or queries that you may have. Thank you.